Hey crew, welcome to the MMOA podcast. My name is Dr. Shelby Blankenship. I am one of your TAs with the older adult division. I am primarily in live and in L2. So if I haven't met you yet, I hope to meet you at some point. Today we're going to be talking about adductors in the older adults. And we're going to try to level this up a little bit. I think sometimes this is a muscle group that tends to get left behind quite often or just gets put into the ankle pump category of using just that ball and squeezing the absolute bejesus out of it. So we're going to try to level it up a little bit today and kind of give you some options, not only for doing that, but also why we do that. When it comes to the adductors, a couple of things that we are primarily trying to get after when it comes to this population specifically. And the first one is pelvic capacity. Now, I think it's kind of like obvious, like where that insertion in or origination of the muscle groups are. You're like, yeah, of course. Why would it not be part of like the pelvic complex? But especially with this population, where we're thinking about things like incontinence or pelvic pain, or history of pelvic issues, whether they've had surgeries or not. And what we want to do is make sure that we are not leaving opportunities for strength training, especially for that pelvic region, on the table. So while it's kind of an oversimplification, creating a strong and robust adductor complex is going to help create more pelvic capacity, especially when it comes to just that pelvic, that bowl shape of that pelvic musculature group, and making sure that it has more capacity so that it can maintain more of that gait position, rather than just constantly feeling like anytime it gets that extra pressure, whether that's from a Valsalva, from trying to get, whether they're in that 1 rep max living type of situation or whether their bladder is full, we want to create that gait to limit those opportunities for incontinence. And so like the Pelvic Live and Pelvic just course curriculum does a great job kind of going through more details of this, but just kind of from a surface level, it kind of makes sense, right? Your pelvic bone and your adductors are right next to each other. And so if you get your adductors super strong, you kind of help create more pelvic capacity. It's the same thing with glute strengthening, abdominal strengthening. Those things are so close to that pelvic group that if we create more robustness in there, we're more likely to create more robustness in the pelvic floor. And then what other ones can we kind of think about? One of the other ones is balance, like single leg balance, particularly. That static capacity and sometimes dynamic capacity that we need, those adductors are working really freaking hard. They're not like a primary mover, so we don't think about them as much, but they are such an important stabilizer. And especially if they lack power, we really see that quick stepping, especially laterally, go downhill really fast. So we want to make sure that we're training that single leg capacity, but also that quick step. Oftentimes we work on this in the older adult live course when we're working on like the mini best options, especially for lateral stepping. And we want to make sure like not only are we looking at it from like an isolated strength, we don't want it to just be, hey, I can hold, do a single leg balance for 30 seconds. It's, hey, can I do this from a dynamic capacity where I'm having to do this more static hold, but I'm doing dynamic reaching, or within and without the base of support, or even maybe adding more complex things like stairs. You think about how much single leg balance is required for stairs and or lunges. And it really is one of those areas that if you don't train it, you're not going to be good at it. And if you're not good at things like stairs and lunges, you're really limiting your capacity for getting on and off the floor, or getting in and out of a home, or attending certain appointments, or being able to attend events. And so that's another area from a functional capacity we want to look at. The last one is think about your deep squats. I can't, we often go into like knee valgus being like a big fault that we see. And especially like when people are going down into their squat, if you see that knees caving in, you're thinking like they're probably really limited on an abductor strength capacity. But when they're coming up, if you see that, we see it often in like some of the like Olympic athletes, or even some of our just athletes in general, you'll see this like knee whip. We call it an adductor whip, where that adductor magnus is really helping us out. You see it quite often with people like me who have some long femurs, and we need as much help as we can get to get out of the hole. And it is so helpful for getting people in and out of that really low squat because that adductor magnus ultimately becomes like an extender. And so if we can really start training those adductors, not only can you maybe increase their squat capacity, but you're going to increase their confidence in being able to get out of these like hard positions that most of the time people kind of get stuck in. And so that's kind of like what we want to focus on when it comes to like why we want to train the adductors. The next aspect is like how, where do we start? And so I think it's really easy, you know, everyone goes to like the ball squeezes, and that is not necessarily like a bad thing. Some people like that might be where we need to start, but we need to elevate that. And there are a couple ways that you can do that. One of my favorites is doing either modified or supported Cossack squats, and then eventually transferring that to more of like a loaded Cossack squat. If you're not familiar with what a Cossack squat is, you're basically in a like very wide base of support. It's wider than like a sumo stance. Usually your toes are forward unless you, for whatever reason, can't tolerate that. And then you're bending your knee from side to side. So it almost kind of looks like the old 90s stretches that we used to do back in gym class if you're a millennial like myself. And it's really nice because it works on both adductor length and strength. And it's one of my favorite ways because you can use like rings, you can use a countertop to kind of support you if getting out of that kind of bottom position is difficult. But it's a great way to start. The other ones I really like doing, of course, are just going back to the functional aspects like we talked about: lunges, deep squats, stairs, especially like higher step. Most of the time we're only focusing on that like 6 to 8 inch because that's usually where most people's stairs height are. But if we can get into that 12, 16, like that's really gonna make those adductors work a little bit harder in a larger range of motion, which is awesome. The last one that I really like focusing on is Copenhagen planks. And again, I'm gonna toot pelvic again. They do an awesome lab in their live course of kind of going through options and opportunities to kind of like down regulate and up regulate how intense it can be. But it doesn't have to, again, be just like that simple adductor squeeze. We basically get into a side plank and you have either plates or something that you elevate. Your top leg is your base leg, the one that you're really going to get after on the adductor. And then you're just going to either lift your hips and keep your knees on the ground, or that bottom knee on the ground, or you're going to lift your hips and try to get that knee off the ground. So the majority of the load is on that top inner thigh. And these are really, really great to build capacity. I can't tell you how many people that come in with a lot of like hip flexor issues, and they really struggle with adductor strength, especially my females. If they have any history of incontinence or pelvic issues, or especially things with like getting in and out of the car, like you think about how much adductor requirement that is, not only from a range of motion perspective but a strength perspective for some of our folks. Like this is a great way to really get after that in a more like isometric, isolated standpoint without necessarily having to do like a large range of motion. Once you kind of get through that Copenhagen plank, you can kind of graduate and do a longer lever arm on that Copenhagen plank, where you do, instead of just like plates stacked, you can do a bench and go from, instead of your knee being supported, maybe more like that lower calf, and then eventually like your ankle. And I'm telling you, this is one of those things, like it gets people on and off the floor a lot, and it really kind of isolates that muscle group that we're going after. As far as how much, like as far as like how many reps or how long to hold these positions, if you're doing the Cossacks, I usually start with 3 to 4 rounds of 6 to 8 reps. It tends to, that first few can be a little bit spicy for some people, and it just allows them to kind of feel that motion. And then as they get more and more warmed up, they're able to kind of go into a deeper position, and it really allows those adductors to work for us. As far as like the deep squats or lunges, usually like with lunges specifically, I will do them supported with like PVCs or rings. Start there and then try to take away like that upper extremity support, because then it will allow the adductors to work a little bit harder. But I will also kind of have them set up where they're inside a rig, and I will stack a few ab mats and then have them do more of like an isolated static lunge where they're going up and down, and then they have that rig for support if they need it, but it's more like their hands are sliding up and down, and then we'll lower the ab mats to allow more of a deeper and deeper lunge, so to speak. And then as far as deep squats go, I usually will have one of my like lower boxes. So usually like a 12-inch, maybe I'll stack a couple plates on it if that's a little bit too deep, depending on the height of the patient or what their capacity is. And then I will use rings and have them sit into that deep squat, see if they can touch their behind, and then have them just raise up maybe like an inch, maybe half an inch if they can, and do more of like almost like a variation of a wall sit, but their hands are kind of there to kind of help them get out of that deep squat position. But this is like a great way to kind of work on not only a deeper squat, but also getting a little bit of that isometric adductor going on. Now, when it comes to the Copenhagen planks, I usually will start out with like a 5 to 10 second hold. These don't take long to get really spicy. So you kind of want to have it set up almost like a Tabata where they're kind of working for a short period of time and then they might have a longer rest and staying on that side and then maybe going back and forth between sides depending on how quickly they can transition. I usually will do maybe like 3 to 5 rounds of 5 to 10 second holds, kind of see where they're at to start, and then we'll switch sides. That is a great place to start. And then eventually we want to kind of get into maybe more of like 15, 20 second hold, and then kind of go where the rest gets shorter, like a traditional Tabata would be 20 seconds on, 10 seconds off. They can get pretty spicy, so be mindful of that when you first start training these. I would not go very hot out of the gate. Definitely go more the 5-10 second. It's a lot easier to be more conservative and then get like a little bit more juicy as you go versus trying to come out really hot because it can get super uncomfortable. So just to kind of recap, adductors, super, super important group for our older adults, one that we tend to miss a lot. And the biggest reasons that we need to get after it is pelvis. We have a lot of people with a lot of pelvic issues, whether that is incontinence, whether that is prolapse, whether that is pelvic pain, whatever it might be. That is an area that is always needing some extra love. And so adductors getting some love and support ultimately is going to transition to that pelvic area getting more love and support. We also want to make sure we're getting after some balance components. That's quick stepping laterally, the single leg balance, stairs, all those kinds of things. We want to prevent falls. If we can get those adductors a little bit more reactive with the power component, and you might have to start isometrically, but eventually getting the power component, super, super helpful. And then of course, functional movements. We think about our deep squats, our lunges, our stairs, all those things need those stabilization of the adductors. So we have to get after it. And then we kind of gave you some ideas for some treatment options. Don't stick with just the ball. You might have to start there, but that's not where you need to stay. Think about your Cossack squats. Think about your deep squats. Think about doing things like lunges and higher step heights on your stairs, or doing things like Copenhagen planks. So often we think about that's only for my athletes or my super robust folks, but I'm telling you, like, these folks can do it. You just have to set them up appropriately to do that. Now, as far as courses we got coming up live, we are going to be in Glendora, I hope I said that right, California, July 11th. We will be in Bellingham, Washington, July 18th. And then we will be at Summit, which we hope to see you all there. It's going to be so freaking awesome, in Littleton, Colorado, July 25th. As far as L1 goes, the next cohort will start August 19th, and then L2 will be September 16th. So if we haven't seen you at any of these courses, we hope to see you out there and hope y'all have a great rest of your day.